Well, good morning, everybody, and welcome to our natural living series with community herbalist Lily Kunning. We're so excited that she is with us today. She is going to be presenting pandemic era living. And we are very excited that, unfortunately, this is still quite the timely topic, but we are very excited that she can continue to share some education with us on this. So Lily, welcome, and so glad that you're able to join us today. Oh, Lily, I'm sorry. There we go.
There we go. Sorry about that. Yeah, I was just saying, unfortunately, this is still a relevant topic, and will probably continue to be so until we kind of get our acts together as a country. So welcome to our new normal, living with not just one, but several pandemics happening simultaneously. We can go ahead and move to the next slide. So I am Lily Kunning. I'm a formulator for Haven Herbs. I also have a clinical practice, and I teach classes like this one and more intensive classes and wellness coaching. Just so you have a background of who I am. I also wanted to let you know that, I am a medicine for profit skeptic. I've seen the damage that pharmaceutical companies and insurance companies have done to overall healthcare in this country, people not being able to access it because of money. And I have also seen the recalls and side effects of pharma. That said, I will let you know, I am vaccinated against COVID and boosted. So is my child. My child had an abbreviated CDC schedule because what is required of the from the CDC now is a lot more than what other generations have been required to get. But I just wanted to put it out there that I look at these issues and I research, and I have a holistic perspective. And I'm putting this out there as someone who is steeped in both science and generational wisdom. So next slide. So with COVID-19 in particular, it is far from over. We're getting a lot of messaging in the media that, oh yeah, rates are going down, you don't have to worry about it. You don't have to mask in public anymore. But statistically speaking, the United States has been a mess. We are winning at losing. We have more cases, more infections, more spread, more deaths than anywhere else. And it is still rising, right? So we took a big plummet for a while after extreme measures were taken to contain the virus. But since those have been released, people aren't masking in public, for example, we have been on a steady incline, so in terms of cases. And while our deaths have gone down because we do have some treatments, the fact is that people are still dying, about 400 a day from COVID. And long COVID is becoming a huge problem in this country. Long COVID is sort of a generic term for all of the long-term problems that people are experiencing from having an infection. And it could have even been a mild infection where a couple of days of respiratory and fever, and they're like, okay, well, that was no big deal. But it's coming back in organ failure, heart problems, brain fog, neurological problems. They framed COVID as a respiratory illness in the beginning, but it is not. It is not a respiratory illness. It may affect your ability to breathe short term, but we're finding that it is more cardiac and neurological in terms of long symptoms. And today I'm going to go over tips of what you need to do to breeze through the pandemic. This is basically a lifestyle tips kind of presentation. I'm not going to get into statistics. That's what the handout is for. The handout literally groups different articles and studies by category for you, so you can read up and take a deep dive into the statistics and the science of what I'm presenting here today. But I'm going to give broad brushstrokes. If people want me to dive deeper, please feel free to ask questions. But I have documented my sources well in that handout, and you can take a look. So we're finding that the long-term damage for people that experience long COVID is much scarier than the initial infection. So what we want as a country is for less people to become infected. And so we need, if we're not going to have policies in place, because it seems like our country is kind of unwilling to do that again, individuals who are concerned need to take measures, because we not only have COVID now, but we have Mpox, we have other viruses happening, and we also have this really, really intense flu that's going around. And we do not want them to infect a lot of people, because then they have the chance to mutate and become even worse. Large gatherings should be avoided. Quarantine when you have symptoms or you've been exposed is still necessary. Social distancing is still necessary, as is masking. The government should be giving people paid time off, but of course, we've always kind of been on our own that way when we're infected. We don't have a sick policy to avoid exposing others. And frankly, employers have not been very helpful in this regard either. So people with other conditions like cancer survivors are especially at risk. You're immune compromised. And so I am happy to be here talking about some tips that you all should consider to help stop the spread, stop infections, and stop the death rate that we are seeing now. So this presentation is all about a toolkit, building a toolkit to stop pandemic. And we want to use all the tools possible. Next slide. All right. I just went over that. Sad, bad charts. We'll just move on from there. You can read the charts. So what should we do? There are quite a few tools in our toolkit. So the vaccine and its boosters. So what is this tool for? There's a lot of misinformation out there. I see it very casually tossed out there in the media when people are talking about the vaccine. The vaccine does not replace masking. Just because you are vaccinated does not mean you no longer have to wear a mask. The vaccine exists so that you don't die when you're exposed or infected. It trains your immune system through mRNA to recognize these spike proteins that come from COVID, and gives your body a jump start, a head start in fighting this infection. That is what the vaccine is for. The vaccine is secondarily for killing that virus before it has a chance to mutate and you spread it to others. So creating new strains. That is what a vaccine is for. That is it. It does not prevent you from getting infected. It does not prevent the spread of infection. It is only there to protect you and stop mutation. So when you hear people say, well, I'm vaccinated, so I'm not going to wear a mask, they're comparing apples to oranges. And I'll show you what masking is for. The vaccines do not replace social distancing either. So just because you're gathering, even in a small gathering, like a family gathering over the holidays, for example, it does not replace masking in that situation, social distancing in that situation, and decent ventilation. Somebody who's having a gathering of people coming from other areas who have potential of coming in exposed, they should change all of their HVAC filters before the gathering. They should provide masks. They should make sure that the seating arrangement is such that people are distanced. Vaccines do not replace those measures. Next slide. Wearing a mask. Everybody hates it. Nobody likes it, even me. You know, I still am one of the few people when I am out and about at the grocery store or whatever I'm doing, wearing a mask. It's infuriating, to be honest, because wearing a mask not only protects you, but it protects the community. Like that's what it's for. And so people are like, they're uncomfortable, or, you know, they're expensive. And it's like, wear it to protect your community. Now, not all masks are created equal. The cloth mask that we were all wearing at the beginning of this pandemic, not going to cut it. If you are still wearing a cloth mask when you go out, you are only good for about 20 minutes of possible exposure in a mostly unmasked environment. It needs to be super snug. It needs to go over your nose, over your mouth, no gaps. All masks need to be like that. So if you have a mask that has slight gaps or it fogs up your glasses, you have too much ventilation going in and out of your mask. Okay. Definitely the little nose clippy thing is important on your mask just to make sure it's a tight fit. But find a brand of mask that fits your face well. And no more cloth masks. Again, if you have to be in a grocery store for 45 minutes because the lines are long, a cloth mask is only good for 20. And as soon as your mask is wet, it is no longer effective. And your breath obviously makes it wetter and wetter. And if you accidentally sneeze or cough or, you know, whatever, it gets wet. So my recommendation is using a disposable N95 or getting a P100 with disposable filters. Now, a really good place to get that is the N95 Project. You can Google that, the N95 Project. Their job is to get N95s into the hands of anybody who wants them. That's where I get my N95 masks. I use disposable N95s when I go out. I buy them by the case, the box, and I keep some in my car and I keep some in my house, and I have them at all times. So the thing about N95s is that they are definitely the standard, but they're only good for 5 hours in a mostly maskless environment. So when I was working an 8-hour shift in a place where most people were not masking, my coworkers and customers, I would go into the bathroom. I would take off my mask, hold my breath, and put on a new one. Because every 5 hours, you need to swap that out. Or if it gets damp at all. So you need to swap out those disposable masks. Surgical masks are second to N95s. They gap often. Usually those surgical masks are used by surgeon in concert with another type of mask, like they're on top. And that's how they are good for this infection. They are good in combination with other masks. They will add a layer of protection, but again, you need a mask that is nice and tight over both your nose and your mouth. All right, next, washing your hands. It's like we forgot germ theory, like when we were taught as kids, you know. It sounds really simple, but so many people skip it. And when you are washing your hands, I know that this is basic stuff, but soap is important and hot water is important. And the length of time that you are rubbing your hands together with soap is important. So singing, oh, I mistyped happy birthday. I hate it when I have typos. Now I'm pointing it out so all of you see it. Anyway, sing happy birthday, like the whole song from start to finish as you are rubbing with soap, and then rinse with hot water. Now, it's not always possible to wash your hands after potential exposure. And so I use hand sanitizer and wipes that are antiviral, antibacterial wipes to help me when I am out and about and I cannot wash my hands. So here's what I do. I have hand sanitizer in the car after I go grocery shopping and I've been touching things, or I've pumped gas at the gas station. Before I touch anything else, I touch that bottle of hand sanitizer and I sanitize my hands. I also use the wipes to touch things. Like I'm not touching that gas handle. I'm just not. I know it sounds tinfoil hat, but I'm not going to do it. I'm going to use those wipes and I'm going to have a barrier between me and that gas pump while I'm pumping that gas. Because I see people coughing and wiping their noses and like putting it all over the place. I don't have time to get sick. I just don't have time. I'm too busy. So I'm not going to do it. And I'm going to have these basic things around. It's part of my regular shopping list now. It's just something that I need to keep on hand like toilet paper. And they are everywhere. And they're definitely in my car because I'm getting the most exposure when I'm out and about, right? With my little pod, my people here, like, we don't wear masks at home because we have agreements that when we are out in public, we are always wearing masks. We are always washing our hands. We are always using sanitizer. So while it's possible they could bring something home and expose the house, it is much less likely. And we take precautions here. But when I am out, that is when I'm being exposed to all kinds of stuff that I don't want to get. So that's definitely a thing, having it in the car when I'm going around. Next, hand sanitizer. Not all hand sanitizers are created equal now. The World Health Organization recommends a hand sanitizer that not only has alcohol, but also has hydrogen peroxide in it. And they actually have published a recipe that you can get online. I think there is a link to it in the handout, the WHO hand sanitizer recipe. It kills viruses as well as bacteria, because a lot of hand sanitizers were formulated out there to kill bacteria, but viruses are extra pesky. So you need a little bit more ammo in your hand sanitizer. So if you wanted to make it, it's actually really cheap, like a bottle of hydrogen peroxide and a bottle of rubbing alcohol, and then a few extra things to make it so that it's not like making your hands into the desert, right? Some glycerin or some aloe or something. But using hand sanitizer, keeping it in your car, keeping it in your purse, keeping it in your pocket, having those wipes there. I have a little pocket pack of wipes in my purse, because now when you go to the grocery store, they don't have the station refilled full of sanitizer and wipes anymore. I can't wipe down that cart anymore. Most of the time it's just empty. It's just sitting there, not being restocked. So I am doing that. Like, I have it in case it's not provided to me. You know, when there are publicly touched items, I mentioned gas pumps, but ATM machines, I have a wipe between me and the machine. I'm not necessarily wiping the whole thing down before I start, but I have the wipe and I'm boop, 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 boop with the wipe over my finger. I don't care if I look crazy. I haven't gotten COVID. It's been 3 years, no COVID. And I've had people in my house have COVID, right? So, you know, we got exposure. I was living with a nurse for a while before I moved into my house. And, you know, she brought home COVID. And, you know, we have to share bathrooms. I was masking 24/7. I was sleeping in a mask. It was terrible. I'll tell you, the bridge of my nose was all raw from those mask pinchy things. But I didn't get COVID. She thought I was crazy. You know, she kind of has that nurse fatigue where she's just like, it's gonna happen. You know, there's nothing you can do. It's gonna happen. And I'm like, yeah, I know that you have a job like that, but I don't. And I'm not gonna get it if I can help it. And I did. So if there is anecdotal evidence to be shared here, it's taking measures and being willing to look like the crazy tinfoil hat lady in public works. Next slide. Keeping your distance. This sucks. We are social animals. We need touch. And this is probably the hardest thing. And, you know, because of these measures, we saw people with higher incidences of anxiety and depression. There aren't enough therapists in the United States to handle all of this, but we still need to keep our distance. Now, the way that you can still get human touch and feel connected has changed, right? And you can actually make agreements with people in your home that outside the home, you will take these measures like I've done, right? We've all agreed. We actually have a written out policy that this is what we all agreed to. Masking in public, social distancing, minimizing our time in public, changing N95s every 5 hours. We've itemized it. And so there's no assumptions on our part. But, you know, you can make agreements with those folks that then when you are in the home, like you can have that affection, you can get a hug, because you've taken the other precautions with others that you don't know their behavior. The reason we have to keep our distance from people is because we don't necessarily know what their behavior is. And if you ask people, are you being safe? They're all going to say yes. They all believe they're keeping safe, even if they're not wearing a mask 100% of the time out in public, even though they're going to the movies, even though, you know, like all of these things that pre-pandemic we took for granted, you can't take them for granted anymore. And so avoiding gatherings is still relevant. It sucks. Especially indoor gatherings is what you need to avoid. Outdoor gatherings, you have more ventilation. You can still keep your distance, but you can have outdoor gatherings. So family reunions this summer, just keep your distance, and mask when you get close. If you're going to eat slightly apart from people. Don't sit shoulder to shoulder at a picnic table. Indoors should be no more than 10 people, all masked with extra ventilation. You can actually make extra ventilation with a box fan and an HVAC filter. And that does help, like drawing air through the filter away from the crowd. Outdoors means masked if you're within 6 feet of each other, it still does. And no large gatherings. These people who are going to these, you know, big multi-day concert events, oh man, like they are super spreader events. And it's like we have this weird collective amnesia. Like people are going to these events and then immediately after they report that, you know, there's been an outbreak over here. And it's like, huh, I wonder what all those people have in common. Contact tracing shows large gatherings, whether they're indoor or outdoor, mean infections. So keeping your distance is important, no large gatherings, and staying 6 feet apart and masked if you're indoors. So one thing I want, like personally, I am trying to start another herbalism class. And it's, you know, between 10 and 20 people usually that take my herbalism intensive. And we meet once a month. And we, you know, in the winter months, we need to be indoors because it's cold. And then in the summer months, we tend to spend a lot of time outdoors because we're learning about plants and we're taking plant walks and things like that. But what do I do in the winter months, right? We're starting a class when it's still cold. So number one, I have a disclosure contract they sign. If they are exposed or if they are exhibiting a list of symptoms or they have a diagnosis of specific illnesses, they must disclose it to me and they must not come to class. And I will provide a Zoom link for them to participate in class, period. Like that is how it goes. We also mask. If we are indoors, we are all masking with each other. And if we are outdoors, we stay 6 feet apart or we are masked. And those are the agreements that my students make in order for them to be part of the class. So I just kind of wanted to outline that as like a real world example of how I've thought about this. How do I make an event safe? Like I still want to continue teaching herbalism and training the new herbalists of the world. How do I do that and still respect the fact of the reality that we live in a pandemic? So those are some examples. Next slide. Testing, isolation, and reporting. Okay, so if you are exposed, like, you know, you hung out with someone, even if you were masked, you hung out with someone and then you found out they told you, oh, I got COVID. So first, you should immediately shut down, test immediately. But if it was like within 3 to 4 days of exposure, you may not be able to test positive yet. So you test immediately, but then you wait 3 or 4 days after the exposure and you test again. Because it takes a while for those antibodies to show up in your system. And most of the home tests that we have are antibody screening. So if you are sick, obviously, stay home. Stay home and isolate from other people in the home. So when I had my partner and my child have COVID, we needed to isolate them from anyone who was healthy in the house. So they stayed in one room. They were brought food and they ate it in that room. When they used the bathroom, they, did it efficiently. They didn't linger, and they were wearing masks 24/7, unless they were eating or changing their mask. Like, that is the level that you need to think about it, because I know it seems like, oh, it's just like the flu. We've all lived through the flu. Number one, the flu is lethal for some people. Number two, it is not like the flu in that you could have a mild case of initial infection, but that virus is still in your body, and it, I believe it's 20% now of people who had an infection are now experiencing symptoms of long COVID. And we don't even know the extent, right? Neurologically, cardiovascularly, different organ failures like kidneys. You don't want to live the rest of your life on dialysis. Like, that's not why, when you could take some prevention. So if you are sick, do not leave home, isolate from others, wear a mask inside and in shared areas, especially. Allow others to prepare meals for you and leave them for you instead of contaminating the kitchen, right? Do not go downstairs and make yourself a grilled cheese, please. Don't go to work. Don't infect other people. And if your boss is being a jerk about it, have a televisit with your doctor, explain your symptoms, and get a doctor's note that way. Report illness to anyone. So if you are actually sick, you test positive, please let everyone know that you were with, whether you were masked or not, within 15 days of getting those symptoms, because we need to protect each other, because no one else is doing it for us. So protect your community by letting folks know that you may have exposed them to an illness. And here's the thing, right? We have the COVID tests, but the flu that's going around right now is horrible. And you're not going to test positive if you take a COVID test. If you have that flu, you still need to stay home and don't spread that flu, because that flu is killing people, especially children. It's really bad. So we need cooperation from everyone so that all these pandemics can be overcome. These tips and tools are there so that we can use all the tools in the toolkit to overcome the pandemic. We want to stop the spread. We want to stop the deaths. We want to limit infections and suffering. And the only way we're going to be able to do that is if more than a smattering of individuals spread out over a period of time do it. And that's what's so frustrating to me, right? The government had a decent policy when COVID first came out. And then when everything was shut down and the economy shut down a little bit because people weren't shopping and people weren't working, that is when the policy changed. The policy went to protect the economy. And we still see that, actually, those discussions happening in the media. It's like, but the economy, and it's like, you know what? The economy is there to serve human beings, not vice versa, right? And so we need to care enough about our human community to say, you know what? Can't go to work. You know what? I'm not going to go to the grocery store. I'm going to get my groceries delivered. In the very beginning part of the pandemic, we were really unsure to the extent that we needed to protect ourselves. We know now. And just because the messaging is one that is beneficial to the economy and not to public health does not mean we don't have the facts and the statistics there. One of the things that has been disappointing to me is that I can't rely on the CDC for accurate information. It's become really obvious that there is an alternate agenda there. So I look at other countries and their health organizations, or I look to the World Health Organization for recommendations of how to be in the world. The World Health Organization is very clear, science-based, and has lots of downloads, PDFs and things that you can read about COVID. And like I said, they even have a recipe for hand sanitizer that's available. I would definitely start there and not the CDC. That breaks my heart that is something that I have to recommend to people, but that is definitely where we're at. I also kind of wanted to talk a little bit about the treatments that we know are working for COVID and which ones definitely do not work, as well as the pros and cons of each of the vaccines. But I'm interested in hearing what questions people have, whether it's about vaccines, masking, the virus itself, any of the other pandemics that are out there, mRNA technology. I would love to know what you've heard out there that you're not sure is true or not, or what measures you're taking, and is it different than the people around you? So feel free to unmute.
I have a question.
Okay.
I know of somebody that recently had COVID around Christmas
Mhm.
and now has developed blood clots.
Yes.
So the comment that was made was they didn't know if it was from COVID or from the vaccine, or and she seemed to think that that was a common theory. And I was wondering what you know about it, because frankly, in the 3 years, this is the first time I know of someone getting blood clots afterwards.
Yes, it is actually one of the symptoms of long COVID. And it was a symptom that happened for people that got the J&J vaccine specifically, not the mRNA vaccines, which was the AstraZeneca, the Pfizer, or the Moderna vaccines, but the J&J one in particular, which was sort of a dead virus vaccine, the vaccines that we've seen throughout history, not the newer kind. That definitely had a side effect of blood clots as well. I'm not sure which vaccine she got, and I don't know if you know, but yes, long COVID definitely has long-term cardiovascular problems associated with it. Inflammation of the pericardium, blood clots, all kind, stroke. Just it's terrible. Yes, that is, while anecdotally you only know one person so far, it definitely statistically across the board has been a thing.
Thank you.
Yeah, you bet.
I have a question. 6 months ago, it seemed at church, everybody was wearing masks that had PhDs or degrees in science. I don't see that anymore. It seems like it's at the point where, but there really, frankly, aren't that many people in church. It's getting smaller and smaller
Yeah.
since the pandemic. But I notice any type of a health care facility, you go to the James or go for physical therapy or anything like that, you're still wearing masks.
Yes.
Yeah. Yeah. Definitely in healthcare settings, people are still requiring masks. I went to the dentist.
It's hard to wear a mask, isn't it?
It is, but they require a mask at every moment than when they're in your mouth. And they're wearing masks and they're wearing gloves. and they make you disclose if you've had any adverse symptoms before they get in there. I know we're all tired, right? We all have COVID fatigue, whether it's neurological fatigue or emotional fatigue of having to deal with all this extra crap, right? Like nobody wants to wear a mask, I have a 13-year-old and sometimes, and he's homeschooled. So leaving the house has always been like a fun thing. It's like a field trip, right? He doesn't want to go out anymore because he doesn't want to have to wear a mask, you know? It's a bummer, right? But it's still required. And a lot of people are just opting out instead. They stay comfortable at home now, and they're not going to places, which is a bummer because, church and other places like that are places for us to gather and come together as a community. And we definitely suffer when we don't get that. I know that there are still churches out there that are doing Zoom services, but and here we are on a Zoom class, right? It's not the same. It's second best, but it's not the same, right? I miss being in a room with other people and connecting with them. There is a thing that happens, chemically, electronically, however you want to say it, like you connect to people, and that's hard to do on a Zoom meeting. But I miss it. But it's definitely still required. And even people who are smart and educated in science are tired of it. And so sometimes they slip. The nurse that I mentioned I lived with, she's required to wear a mask at the hospital. She wasn't exposed at the hospital. You know where she was exposed? The grocery store. She forgot her mask. She left it in the truck and didn't feel like going back to get it. And nobody else was wearing a mask anyway. She always felt weird and awkward, being the only one, being stared at. So she didn't wear a mask. And guess what? She got COVID. She brought it home. She gave it to my child and my partner. And while I was fortunate not to get it myself, because, oh my gosh, like there are 3 people that I live with that have COVID. It's those little lapses. It's those tiny decisions that we make in the day-to-day that actually have a big impact. That's why I always have a big stack of masks in my glove box. So if I forget and it's not in my purse, I still am like, okay, I drove all the way here, because where I live, you got to drive at least 30 to 45 minutes to get anywhere. I drove all the way here. I have to go into this place that I am supposed to be at. I have a mask. Like I always make sure that I'm preparing myself that way. And that way we don't just let that, it'll be fine behavior happen, because chances are it won't be fine. There's enough mutation out there. The virus is actually even more aggressively spreading than it used to, while we're not having as many deaths from it because the treatments are better and our facilities are better prepared. It's spreading fast. It's spreading a lot. And we don't want to give it the chance to get more virulent, right? When we first got the first variant, the Delta variant, in the United States, people were like, oh, this is hard. And then they were like, oh, Omicron. Do you remember when they were first talking about Omicron? They were like, oh, this is nothing. It's minor. It's just like a little flu. But Omicron is the one that's giving people long COVID. So it seems like it's no big deal. And then it just works on getting everywhere in all of your systems and causing problems. So, we want to take those precautions. So yeah, I totally get it. It seems like everybody's just given up and not wearing their mask, but it still is important to be that weirdo wearing a mask at the supermarket.
So I don't know if you see the chat, Lily, but Elaine says, not sure how to handle seeing friends and family that are not following these measures. I am still masked, vaccinated, and distancing going out in non-peak hours.
Yeah, it is hard when you see loved ones making decisions that could ultimately harm them. And I would say, when you're not in that moment where it could be potentially conflicting, right? You want to approach people in a way where they're open and receptive, right? So if you are having a conversation with them, maybe say, hey, you know, I read this really interesting, or I was at this webinar and I got information that was new to me and I'd like to share it with you. And feel free to send that handout, and it's dense, right? It's just by topic, and then there's little links for people. So you can send them this slideshow as a starter, like, hey, you still need to wear a mask. Hey, it needs to be an N95. Hey, you need to change it every 5 hours. Send them this and send them the handout. I am happy to let you share it with whoever. The point of these free classes is to spread information and make an impact. So please don't feel like it's proprietary in any way. Please send it out. There is going to be a video of this webinar available on the YouTube channel for Cancer Support Community. Link to it, right? Send it to people. Say, I care about you, and I know you might not want to hear this right now, but I'm concerned and I don't want to lose you. Make it personal, right? Put it in a way that isn't like, hey, dummy, you know, you shouldn't be doing that. It's more like, hey, I love you and I want you around for a long time. Can you please watch this and maybe consider changing your behaviors so that I can have you around for a while? I'm being selfish here, you know? Something like that. Calling people in instead of calling people out, like, hey, you're not wearing a mask. You know, can go a lot further, even though it is frustrating, right? I get frustrated and I'm like, you know, and when I realize that I've been ranting too much is when I hear it come out of the mouth of my 13-year-old, who is like my mirror. And we're out and we get in the car and he's like, did you see all those people not wearing masks? I'm like, I did. Oh boy. Yes, I did. So yeah, calling people in and just being able to share information with them in a non-judgmental way, I think, is the best way to make inroads. And that's on any topic, right? It could be on the pandemic, it could be on racism, for crying out loud. You know, calling people in and saying, oh man, you know.
Yeah, I usher for Kappa, and I still wear a mask. About 10% of us do, and all the house managers.
Yeah.
And last year I did probably about 110, 120 shows, but I was masked. But if I do the scanning, I'm scanning probably 200 or 300 people. And so I just really feel more comfortable with the mask. But I would say very few of the patrons wear masks anymore. Very, very few.
Well, the messaging has been, you know, the messaging is all about making people comfortable to go out and spend money and make money.
Yeah.
It's been about stimulating the economy, and that's the messaging that we're getting. And so the messaging is definitely about, like, just do what makes you comfortable. And there's been this shift in messaging about, oh, well, you're vaccinated, you're fine.
Yeah, but all the house managers, and I don't know if they're required to wear them, everything, but they are wearing the mask. So that's kind of interesting.
For sure. I mean, there may be a requirement. A lot of employers do require that, but not all. But it may be, it's like, well, I'm breathing the air that 200 other people are breathing, and I don't know where they've been, you know?
Yeah.
Yeah. So there are measures that I no longer do, that I did during the height of the pandemic, where masking was required by most people. And I will let you know what those are. When I would get my groceries delivered, because for a while I was not going to the supermarket, I was getting them delivered. I literally wiped all of them down with rubbing alcohol. I no longer do that, but I do wash my hands after. The other thing that I no longer do is, I used to have a job where farmers would come into a warehouse, And those folks were definitely not wearing masks out and about in their lives, but they would come in and they would be required to wear a mask in the warehouse, and they would put their items into like refrigerated totes. And then I would have drivers come in and take those totes and deliver them to people. It was like a farmer's market service. And I
Yeah.
was logistics manager. So I did that, and I required masks of all my people. I required masks of the people coming in. And I also had a pan. I used like an oil change pan. I put bleach water in it about 2 inches deep, and I made everybody step in it before they came in my warehouse, because COVID, we found, lives on hard surfaces for up to 2 days. So if someone has been exposed, they've been in a place like a supermarket and they've walked through where people have coughed and sneezed, and gravity happens, they're tracking through, so it could be on their shoes. So I would have them step into a bleach pan, the way that you do the same for any sterile environment. Like if you're growing mushrooms, for example, you need to do that. But I had them do it before they came into my warehouse, and I got a lot of
Whack on that one.
yeah. But you know what? I was like, you don't have to come in. You don't have to sell your stuff here, and they did it anyway. But I no longer require that. I do on my farm, because I'm stepping through chicken and dog and whatever else poop, and I don't want it tracked in my house. But I don't require it at my class, for example. And I'm not going to be sterilizing the classroom space that I'm using in Clarksburg, but I will wear a mask. So yeah, there's a lot of precautions out there that can be taken that I didn't mention, but I don't do all of them myself anymore. But the ones that I put forward in this presentation, I definitely do. I think they're the bare minimum.
Mhm.
I just use a mask for kind of short term, for like an hour or less. And so I want to be able to reuse that mask. So what do you know about practices to keep it so it's reusable?
Yeah, so like I said, an N95 is good for 5 hours in a mostly maskless environment. So yes, I do sometimes, if I run in and I get like an item from a store and I come back out, I will put that mask, down out of its, wrapper or whatever, with the gum that I keep in my car. I keep that, and I mentally kind of keep a track of how long I've used that mask in an environment. I will reuse it. The one thing to remember though is if it gets stretched and is no longer well fitting, it's no longer a mask. So taking it off and putting it on carefully is important. Don't stretch out where the adhesive, like the elastic, meets the thing, and make sure that it's still snug around your nose and your mouth. But if that's the case and it's been less than 5 hours, you can definitely reuse an N95, and they're expensive, right? So, and they're definitely, I have not yet put it in my budget, even though it has been a budgeted for item every month for 3 years, right? It's like one of those mental things where I'm like, well, maybe I should just add it to the monthly budget so that, it's not a little surprise at the end of the month. Like, oh, you were $100 over budget. Oh, you know what that is? That's masks. I should probably, put that in my budget, but I'm stubborn. I'm human. I don't want to think about it being a long-term thing, even though it definitely is.
Lene, you had your hand raised. Did you have a comment or a question for Lily?
Yeah, I had a question. Thank you, Darlene. And sorry, my dog's whining. We might hear some barking, but essentially I had COVID. I got COVID for the first time since treatment the beginning of December of last year. And then I had it. I mean, I was testing positive for like the whole month of December, which was fine. But I actually, my oncology appointment got pushed because I was still having symptoms. And what my oncology team just because I go in every 3 months, for routine blood checkups. But they advised me to go by my symptoms because I could test positive for a few months. And essentially my oncology appointment got pushed. I'm just looking at my calendar for 3 weeks past the original date till my symptoms were done. I guess my question is, I basically, and I talked to other cancer survivors, asked them when they got COVID, kind of what their symptoms could be. And it genuinely, I didn't have the same symptom every day. I mean, one day I'd be really tired. The next day I'd have a sore throat and coughing. The next day it'd be something else. I mean, it wasn't linear at all, which was very, could be frustrating, but I just accepted it. And I knew I needed to get through it. But my team, when I went in January, I think it was like January 5th, it was that first week in January, I think, they advised me to take a COVID test just to make sure like I was done with that round of COVID, so to speak, so that if I felt bad later, I would know that it's like a new strand or a new case of COVID, so to speak. But I guess my question is like, that was January 5th, and what, today's the 20 whatever. And I do every time I leave the house, every time I go anywhere, I'm wearing a mask. And I can't control everybody else, around me, my family, friends, blah, blah, blah. But like this past weekend, I saw family and friends. And yesterday I went to Walmart to print off some pictures and grocery shop, and I was wearing a mask. And today I just feel bad again. Like, I have like a sore throat, cough. I don't have coughing, but I have a sore throat and runny nose. And in my brain, I'm curious if you think that it could be COVID again, because my oncologist team told me that my antibodies should give me a buffering for a few months because I had COVID. So I'm just like you were saying earlier with CDC, it feels like a lot of misinformation, and I don't know where to look to get accurate information. You know what I mean?
No, that's really frustrating. I'm sorry that you're going through that. So some basic scientific facts. You can spread COVID if you are asymptomatic. You can spread COVID if you are no longer having symptoms of your infection. If you are, so the tests that are most widely available are antibody tests, which only detect if you've been exposed. You get a higher antibody response as your body is actively fighting it. And yes, your body should have antibodies after the infection is over. However, you're a cancer survivor and your immune system has been suppressed not only by your body dealing with cancer, but your body dealing with the treatment for cancer, right? Radiation and chemotherapy are things that also suppress the immune system. So there are a lot of shades of gray in there, and it frustrates me when doctors, and I think they do it to put people at ease and to make them feel better. I'm not, saying that they're doing this maliciously, but it bothers me when they have sort of a standard pat answer for people, because it's definitely not like that. Each of our bodies is a unique environment that this virus can occupy, and it manifests in different ways in different bodies. For them to say, just go by your symptoms and then you can go out and do things, was possibly irresponsible, because again, asymptomatic people can spread the virus. Luckily you were masking, right? So, you're doing it in the most responsible way. But the pat answers that are there to comfort us don't always give us all the information we need. I again would look at the health organization for advice.
The which health information? Sorry about that.
World Health Organization. So they're a project of the United Nations. They are a team of experts around the world, and they have a COVID panel. They also have one that helps develop the flu vaccine every year, for example, and other projects. But they have much better information that's sourced from scientists and doctors from around the world. Unfortunately, we have sort of a direct sort of pipeline model in the United States where doctors get specific spoon-fed information, and that's the information that they give to others. And it's not necessarily based in public health, unfortunately, coming from the CDC. I'm very sorry to say that. It bums me out, and I really wish we could depend on our government to keep us all safe, pay us for staying home, provide masks, provide tests for us, give us paid sick time, make sure that we all have access to healthcare. But that is not the world that we live in.
No, and I appreciate that very much. I'm going to look at the World Health Organization, and I took a lot of notes from this. So thanks for all your information. And I did want to say that I did take a test after, when I got a negative COVID test and my symptoms were gone, that was the only time that I then spent time with friends, family. I mean, I've seen other cancer survivors in the month of January after testing negative, and I was wearing a mask. But I'm doing it as responsibly as I can, I guess is all I'm saying. I retested and it was negative. So I was just trying to cover myself there in case I didn't say that the first time.
I completely understand. Yeah. And, when, obviously I hope that people go forward and do the responsible actions that take care of us and each other. But, if you see people not doing the right thing, chances are they've been given misinformation and they don't know. So, holding those people with some compassion, getting them the information that they may need to make better choices moving forward, and hopefully not getting infected. Yeah.
Thank you so much.
Yeah, you're welcome.
So Lily, we have a comment and a question in the chat. The comment is, my COVID anxiety is still high, scary, still COVID free. And then the question is, any opinion on home kits accuracy versus going to the doctor for testing? How often to retest after a positive result?
Okay. The tests there are several different kinds of COVID tests. The ones that are the rapid home tests are antibody tests, which means you were exposed. Your body creates antibodies. However, for people that are immune compromised and maybe don't make as many antibodies, you may get a false negative. They are a product of what they are, right? There are other tests that are more expensive. And you may want to talk to your oncologist about having access to those tests regularly, and they are blood draws. In terms of testing after a bout of illness, you can spread the virus. And this is the thing that, you see economists throw their hands up in the air and go, see, we can't do anything. You can spread the virus up to 15 days after no longer being symptomatic after having COVID. And so it's like, if you're waiting for the virus to pass and that takes a week, and then you've got 14 more days, that's 2 more weeks, 3 weeks out of 4, somebody can't be out in the world doing their job or spending money. And it's like, yeah, that's true. And that's what it's going to take for us to get over this pandemic. Otherwise, it's endemic and we live with it. And unfortunately, in this country, us living with it means people suffer because we don't have the economic infrastructure to help people lose their jobs, not have access to healthcare, all of those things. It's going to get worse before it gets better unless our government steps in and creates some policies around allowing people to take sick time for COVID, allowing people to stay home so that they don't spread it, and giving people access to healthcare. So hopefully those things can change. And I encourage you all to pressure your legislators to make that happen.
A follow-up question, Lily, is how long are you still immune compromised after survivorship?
That is an individual thing. And so one thing that your oncology team can do for you is to do a blood panel to see what your white count is, what kinds of fighter cells you have in your system. Everybody's going to recover in different ways at different rates. And so there's no one blanket thing that I can tell you. I would consult your oncology team.
And unfortunately, that's the last question we can take because we are at the top of the hour, but we are greatly appreciative to Lily and her expertise and her time. Again, this presentation will be sent out to everybody, so you'll have access to that. And Lily has her contact information with that as well. So several comments in the chat that says, thank you, Lily. So again, we greatly appreciate you, and we appreciate your volunteering your time and giving us your knowledge and expertise.
Thank you so much, you guys. Have a great day.
Thank you.
So we will be back next month with Lily, and she's going to be doing a presentation on chronic illness. So thanks for joining us today, and I hope everybody has a wonderful rest of your Tuesday. Bye-bye.